Today's video is going to cover endometriosis. Endometriosis is a disease which is very, what can I say? It's very traumatic, very painful. The symptoms are infertility, pain, and pain even during having sexual intercourse. So it really affects the quality of life. And it's a disease of the reproductive age group. Means what? Once you start getting periods, you can get this disease, and it only ends once your periods stop. So we need to really remember that the diagnosis is very, very important. So if you have any young girl in your family or any lady who has very, very painful periods where her quality of life is affected, her work is affected, she sits at home, doesn't go to school or doesn't go to work because of the pain during the periods, then she definitely needs to be investigated. You need to do an ultrasound or an MRI for her to check whether she's got endometriosis. Endometriosis is simple, just the inner lining of the uterus. It goes and into the stomach or outside the uterus. It is deposited outside the uterus, and during the periods it gets activated and causes pain. But you won't believe it, today I got a young patient who said she doesn't get any pain. So very, very rarely there are people where there's absolutely no symptoms, but that is an extremely rare condition. So what endometriosis does is it destroys the ovary. If the ovary is destroyed, that means you cannot, it's difficult to have children. And endometriosis destroys the ovary. So especially if endometriosis, is diagnosed when you're a young girl of 15, 16, 17, 18, I think it's very important to follow up with a gynecologist, to give her treatment, and of course to advise her regarding her fertility, regarding her future. It is extremely important to do so. And if the girl is married and within the reproductive age group, I think it's very important to advise her about her fertility, because repeated surgery does not really help her get pregnant. It's very important because the treatment protocols for endometriosis have changed now. So if a girl is young, then she must be advised about fertility preservation, that is egg freezing. And if the girl is married, then she can do embryo freezing, because in today's world I cannot tell her get married quickly and have a baby. That would be the ideal thing. Even a young girl who's married, I can tell her please have a baby quickly. But if whatever circumstances do not permit them to have a baby quickly, they must remove the eggs, freeze them, or they must remove the eggs, create the embryos and freeze them. So fertility preservation is really, really important in these patients. And then of course, surgery is usually one of the treatments we do last if it's a patient of endometriosis who wants to have a child. If she has pain and her quality of life is disrupted, then surgery is the way out. Repeated surgery is not the answer for endometriosis. And very often, girls, the endometriosis comes back again. So IVF is one of the best answers for endometriosis. It will help you get a child. So it's better to go for IVF earlier rather than later, because two things are very important. The damage to the ovaries rapidly progresses as the disease progresses, and secondly, the age of the girl also progresses. So it's very important that you should go to IVF faster rather than later. So girls, if you have endometriosis, do try naturally. If it doesn't happen within 3 to 6 months, then please switch over to IVF. I think that would be definitely more fruitful. Please consult your neighboring IVF center and you will definitely benefit from that.